to utilize these two great products in practice, and hopefully we get some people joining us so we can talk a little bit more about the tools. I know there's a lot of people that still don't know them that well.
Yeah.
I don't know. Do you still have a lot of questions about the tools overall?
Yes, absolutely. I feel like people are sometimes saying they've heard about it, but don't know a lot on it. And then definitely like, how can I incorporate this? How can I bring this in?
Yeah, it's exciting to be able to chat with them and be able to show. And I think it'll be great to be able to show this presentation.
Yeah.
So
And then I'm
shall we?
recording it. So if there's anyone that's not joining live, I know we did have over 50 signups. So for anyone who's not joining live, we will definitely be able to share the link.
Awesome. Shall we get in and get started?
Yes, let's do it. All right, so we are here tonight to talk about palatal and Myo Munchee, two tools that we love for patients that are going through myofunctional therapy or going through expansion or tongue ties, different types of interventions. So we love to incorporate these, and Melissa and I wanted to put something together so that we can kind of explain exactly how we have been utilizing these two tools with our patients. I am Toni Antoniato. I am a speech language pathologist. I am a myofunctional therapist. I'm also a certified lactation counselor. And I am the SLP director and business partner of a private practice on Long Island in New York, Long Island Center for Speech and Myofunctional Therapy. And I am also the CPO of SpotPal. I have been doing speech and myo for over 13 years now, and I am currently the myofunctional specialist for the private practice that I'm with, and I do over 400 myofunctional evaluations yearly. So that is the basics of what I'm seeing is myofunctional patients. All right, Melissa.
Well, hello, everybody. I think if everybody would be okay, if we could ask anybody to just mute themselves, that would be awesome. Just so this way we don't all hear each other. My name is Melissa Mugno. I'm a myofunctional therapist and I'm a hygienist. I am the CEO of a company called Faceology, which is a large online myofunctional therapy practice. Also, I am clinical support and admin support for an educational platform called Myo Mentor. And I am the US educational coordinator for Myo Munchee. So I have been utilizing Myo Munchee in myofunctional therapy for quite a long time. I've been lecturing and speaking on myofunctional therapy for over 13 years. I've been in dental for, actually, this slide's a little old. I think it's probably almost more like 20 something years now. And I've worked in multiple different areas of the dental office before becoming a hygienist. And one area I spent a lot of time in was orthodontics. In my alternative universe, I think I always wanted to be an orthodontist, but I had a different journey. I've been a certified myofunctional therapist since 2013. And over the last decade, I've finished and completed over 1,500 myofunctional cases. And I guess I've been known a little bit in the industry as having a niche between myofunctional therapy and expansion from my background in orthodontics, which is what led me to want to collaborate and work with Dr. Mary Burke, who's the CEO of Myo Munchee, because I just love appliances and how they can be supported. And I do some educational support for SpotPal, and I love to work together on collaborating them.
Perfect. All right. A little fun video we put together that you have to see on social media. And we truly do believe that these tools are better together and that every patient is unique. Every patient has different needs, and it's never one or the other for most patients or for all patients. And we love to utilize these two together. Okay, so we're going to start the little video on SpotPal.
Discover Spot Pal, the first ever tongue training appliance, custom fit to retrain, reform, and rejuvenate your speech, breathing, and oral habits, all in one. Crafted to promote proper tongue resting posture and so much more. It's the ultimate solution to eliminate tongue thrusting, thumb sucking, and teeth grinding. Struggling with TMJ, snoring, or mouth breathing? Having trouble articulating certain sounds? Spot Pal is the solution. The Spot Pal achieves these results by integrating tongue pokes that stops the tongue from pushing against the teeth. And the Spot Dot gives the user a tactile cue of where their tongue tip should be while at rest. Designed for comfort and everyday use, Spot Pal has a variety of designs suited for individual needs and dental statuses. Every Spot Pal comes with a virtual training program to ensure proper usage and continuous development. Our users have noticed remarkable improvements in their health, wellness, and lives.
In dentistry, we're not really trained that much about myofunctional therapy, about how it's utilized. But you can train hygienists and dentists to look for patients at an early age, and you could revolutionize their life. Since my son started using it, and the difference in what he was able to do initially to what he can do now is really amazing. And you can tell his strength has improved, and his confidence, I think, is improving as well. I think it's really amazing.
Ordering is simple. Visit our website, thespotpal.com, and click purchase now. Start your journey today.
I will simply say that we have rebranded. So that is our old logo, and we are updating the marketing video, but it still is the same product. We just kind of rebranded, new logo, new colors, and all that good stuff. Okay, so wait, where did that happen? Sorry. Okay. So we're going to go into what Spot Pal is. There we go. Okay. For anyone who does not know, Spot Pal is a custom fit tongue training appliance. So it is made exact to the user's dentition, exact to the roof of their mouth and their incisive papilla. It's done with either an impression or a dental scan. And once we have that impression or dental scan, we're able to make the Spot Pal for that person. Every Spot Pal has this little hole that we call as our Spot Dot, and that's going to be exact to that user's incisive papilla, exact to where we want that tongue tip to rest. And then on the backs of the teeth, you are going to have these little pokes that remind the tongue not to push and not to thrust on the teeth. It fits over the upper front 6 teeth typically. There's different variations which we'll go into, but most of them are just the front 6 teeth. And it has so when we are utilizing this, we're using it both in therapy and practicing at home, and then throughout the day as well. We try to get our users in this appliance up to about 2 hours a day spread out across the day. When we are utilizing a Spot Pal, what are we looking for it to really be doing? It has very similar goals to what we're working on in myofunctional therapy or oral motor therapy. We are ultimately working to correct the tongue posture. So we are trying to get that tongue to rest up in the roof of the mouth, that with tactile cues like that Spot Dot, so that the tongue tip always knows what to find, and that those pokes are reminding the tongue when it does slip a little too far forward on those teeth to back up and get back to where you're supposed to be at that little Spot Dot hole. It also does help to improve intelligibility. There are a lot of speech sounds in the English language that are produced right at the incisive papilla, right at where their Spot Dot will be. So it's supporting sounds like S, Z, T, D, N, and L. There's also a variation of our Spot Pal that we call Speech Pal, and that has bumps on the backs of the top molars. So you'll see an image of that. And that also helps support other sounds like the R, the SH, and the CH sound. It is promoting nasal breathing because we know if we can get that tongue up and we can close those lips, we're going to work on nasal breathing. As soon as that tongue drops for some of these users who have low tongue posture, now the mouth is open and now they're going to be more likely to engage in mouth breathing. So it's supporting nasal breathing by correcting the tongue posture. It is supporting proper dental occlusion by keeping the tongue off the teeth. We all know the tongue is so much stronger than the teeth. So if that tongue is pushing, the teeth will shift. So it is helping to support that dental occlusion by keeping the tongue off of the teeth. And in the same way, supporting the retention. So if they are coming out of orthodontics, we want to, again, get that tongue so that it stays up in the roof of the mouth and doesn't undo anything that the braces may have just done. And then from the perspective of how we work on tongue postures to support patients with temporomandibular joint disorder, we're using Spot Pal in that essence as well to get the tongue to rest up, allow those allow the teeth to be slightly apart and the lips closed so that we're in a proper oral rest posture. The benefits of Spot Pal are that we are going to allow for the user to have that constant tactile cue for where the tongue should be at rest, while also discouraging any types of oral habits, like any type of sucking habit, thrusting habit, the tongue not resting correctly. So even while let me just admit this person. Okay. Even while the appliance is in the mouth, it's giving those tactile cues. But when you take the appliance out because you're not in it all day, say you wore it for a half hour in the morning and now you remove it, you still have the sensation of those tactile cues. So it's still working even when the appliance has been taken out of the mouth. Similar to, why we utilize myofunctional therapy to eliminate noxious habits, this appliance is going to really help because it's going to not just take away a habit, but replace it with proper function. So we're going to try to really get that tongue up there so that you're not looking for the thumb to go up there, so that you don't want the fingers to go up there. You're getting that sensation through proper tongue posture. Spot Pal is definitely assisting in expediting and facilitating speech production and speech therapy and myofunctional therapy in general. We are seeing patients go through speech and myo programs faster because of the fact that we're able to really start working on the habituation piece of tongue posture right from the beginning. There's no, second guessing if they're practicing tongue posture correctly at home, or if they're remembering the whole time that they're trying to do it, because we really can rely on Spot Pal to be that reminder, to be that tactile cue for them when they're especially not with us in the office. It is also going to, like I said, support that habituation as well. Just a little closer image in terms of those features of the tongue pokes and the spot dot. And just remembering that those are completely custom. So sometimes we do make some Spot Pals that don't have any tongue pokes. Sometimes patients have transitioned from a Spot Pal with pokes to a Spot Pal without pokes to take away some of the tactile support, make it maybe from maximum support to a more moderate support. We have some patients who the dentist or the therapist has asked for lateral pokes because they're more of a lateral thruster. So those pokes are completely customizable as well. These are some of the variations. So just to summarize it, ultimately there is a Spot Pal for anyone and everyone, ultimately, except if they're actively in some type of expansion or braces. But we go as young as 2 years old. That's our Spot Pal Mini. They're not in it for as long. Their appliance is a little different, more flexible material, doesn't have the tongue pokes, and they're usually in it about 10 minutes, 3 times a day. And then we have, again, the one that covers those front 6 teeth. We have a junior, that's for mostly mixed dentition. So if it is somebody who is in the process of losing those teeth erupting, we're able to customize it so that those teeth can still come in exactly how we want them to, keeping that tongue out of the way and especially out of that space that those missing teeth can cause. There's a retention appliance as well, where it can be the full bite. You have some lateral pokes, like I spoke about. The Speech Pal, that's the one that has those bumps for the R, SH, and CH sound. And then we also do have a athletic type of sport pal for sports, contact and non-contact sports, because of how much we know nasal breathing supports performance, athletic performance, endurance, recovery. If we can get that tongue in the right place and get them breathing through their nose, they're going to be able to perform better. So we are also doing a lot with the athletes as well. Okay. In terms of Spot Pal in conjunction with myofunctional therapy, that was how Spot Pal was designed. It was designed to complement a myofunctional or a speech therapy program. And although that was what it was designed for, we also understand that there are users or patients or individuals who do not have the resources available to them for myofunctional therapy. And this is therefore a support. You know, we know it's not myofunctional therapy. It's not going to do that for them. But if they have nothing else and they can't get myofunctional therapy, we hope that the use of Spot Pal and the use of the tongue strengthening exercise program that it comes with can help guide them into at least being able to remediate some of their symptoms and hopefully make them realize how important tongue posture is and really lead them to their journey of investing in myofunctional or speech therapy. It is also, as I said, not worn all day, so gradually up to 2 hours a day, spread out across the day. That is that kind of sweet spot for that habituation piece, if we can get them in it that amount of time. But many times we are working our way up to those 2 hours, especially if it's a pediatric user. It can be used during myofunctional exercises. So the way that we recommend it with myofunctional exercises is that it becomes faded out once they are good at that exercise. So we're using it initially to get them to get this exercise done correctly as soon as possible, as quick as possible. And then once it starts looking good, we start to fade it because ultimately we want them to be independent in that myofunctional exercise. And then, as I said, we will work on it from the habituation of proper tongue posture, especially at home. That's been one of my favorite ways of Spot Pal being supportive to my patients, is that sometimes it's hard, you know, life is busy and you're asking them to practice their exercises and that's not always happening. And as much as we want that to happen, if we can make that practicing a little bit easier and kind of meet those families where they're at and be able to say, all right, well, when you're on your drive to soccer practice, pop that Spot Pal in and, you know, think about where your tongue is. At least they're doing something. And then they start to feel really successful because you're excited and they're excited. And then that can start to really jumpstart the rest of that practicing that we want as well. Okay, Melissa, Myo Munchee.
So the most exciting part about these two things together is they really work on something that I like to almost call is like activate and, stabilize these tactile cues. And, Myo Munchee has been around for a really long time. It was originally started as a dental product, and I'll talk a little bit about it. But the concept is that it's very soft and it's actually all about activating the chewing. So it's very flexible. It's comfortable in a position of a natural class 1 occlusion relationship. Originally, it was developed for healthy gums and for oral hygiene. So it works really well in stimulating the soft tissue, which is super beneficial for saliva flow. And ideally, when you get your body doing what it naturally wants to, it really unlocks the neurological development and really helps with craniofacial growth. So it also promotes like positive blood flow into the gum tissues, as well as positive ability for nasal breathing, which ultimately helps all of the main 4 goals that we're looking for when we're doing a functional program with a patient, whether that means that you're coming from the dental side or you're in a therapeutic modality, whatever your clinic situation may be. We're always looking to develop these healthy goals, and these tools are really helping to promote it. I try to always think of an example like about just doing exercises at home, or do you get the ability to do some exercises with some really great equipment? And really that equipment can sometimes change the experience of the workout itself. And that's one of the things I really love about these products. Munchee very similar kind of to like how Spot Pal has different sizes. Munchee does come now currently in multiple different sizes. And I'm going to start first about the mini one, and the mini is from like 18 months to 4 months up. This is a made pretty much for the AP, which is the anterior posterior growth, and it's just comfortable enough for the dentition that would be in around these ages. They are meant to be a little bit bigger and wider to support and push soft tissue development. So meaning it has that like mouth guard effect because it's pushing the lips and cheeks away, which can be really beneficial when we're trying to promote that facial growth. But it also goes all the way up into adults. The adult side was the original one, which was a full arch. And due to demand and over the years that we developed ones that were more accommodating for sizes. The newest line that has been released is the BB. And the BB is really meant for infants and up to 18 months, even into 2 for that smaller, narrow arch development. The BB is currently only available via provider, meaning you have to be a speech language therapist, a hygienist, that's a myofunctional therapist, a dentist. You can also be a nurse practitioner or some type of health provider that is working in this field to order it and deliver it to the patient. It's not direct to consumer. The other ones are, because the philosophy is everybody should be able to chew and chew properly. So lots of great sizes for different patients. The biggest thing that really we have forgotten in craniofacial development and growth is really this amazing lost art of chewing. And chewing has so many beneficials and factors. I really want to showcase this video a little bit. I might stop it halfway through depending on time, but this is the CEO and the owner of MyoBrace, which is Dr. Mary Burke. She's the daughter of the original creator, the original Dr. Burke, who is no longer with us, but he has been in the appliance and he started the appliance game 40 plus years ago. And she happens to be a chiropractor who brings this really amazing philosophy of the cranial nerves and the development. So why don't we hear a little bit about what she has to say?
Hello, I'm Mary Burke, and I'm going to talk to you today about the lost art of chewing. So I'm just going to start with a brief history of chewing. We might be aware that ancestrally we would have spent many hours a day extracting nutrients from our food. And you compare that to what we do now. Most things we either open a packet or a jar and we just put it straight into our mouth. So we've lost a really important component there, and that was the action of chewing. So if we think about what's required for facial growth, we have our tongue. We need good tongue function. We need our tongue to sit on the roof of our mouth. We need a correct swallow pattern. We need nasal breathing for airflow up through the nasal passages. And we need muscular and connective tissue function. And this is where the action of chewing comes in and why it's so important. So what happens when we chew? It's actually quite complex. I don't want you to understand the neurology, but I kind of want you to get a little idea of why it's so important. So the trigeminal nerve feedback circuits from our brain to our face, they inform growth and they activate saliva production and bolus control. So when you're eating, you have your very sharp teeth, you have your soft cheeks and lips and tongue, and your brain's got to coordinate how to make that all work without causing any issues with the sharp teeth. We also have activation of digestion by way of this trigeminal nerve in combination with the vagus nerve and the hypoglossus nerve. And then we have our swallow reflex in plexus with the facial and glossopharyngeal nerves. So there's lots of information coming out of your brain, coordinating this whole chewing function and swallowing and digestion. So when we do not practice chewing regularly, we do not develop good coordination of the chewing process, and the muscles can be flaccid, down-regulating this neural input. So it's actually really important that you use your face muscles for chewing and activate the jaw, otherwise the brain will not get enough messaging. And actually over a third of all your brain's information is coming to the lower third of your face. So it's really important. There's really important jobs your lower third of your face has got to do. We've got to breathe, we communicate, we eat and swallow our food. So it's really, really important that this area is well innervated. So what else does chewing do? Well, it's involved with the regulation and retention of bone growth. So there's a law called Wolff's Law, and it says that a bone will grow in accordance to the forces placed upon it. So it means the more you use your jaws, the more the bones will grow. And that's really important that we get really well-grown bones, because we need plenty of room for the teeth for children, as well as the ability to support the facial function, and the airway. It's also really important for attention and cognition. We know that certain people would chew gums to keep their mind a bit more active if they're feeling a bit tired. There's lots of studies that show it's really good for attention and cognition, as well as cleaning the oral cavity. When you chew, you get saliva production, and saliva is the way that nature gave you to cleanse the oral cavity. When we don't chew sufficiently our food, we don't get enough saliva production, so there can be more likelihood that your food debris will hang around in your mouth and create plaque.
I'm going to just pause it right there. But that really goes into the fact of, just talking about how the important of all this chewing is. So that really brought us to a concept that we wanted to talk about, and that was that activate, integrate, and stabilize. And without, not even really looking at each other's data, this naturally just came when these two appliances came together and when we were putting, different programs together. I don't know about any of you, but I'm a busy, I work a lot of businesses. I have 2 kids. I'm always trying to make sure I do everything right and integrate all this therapy. But ideally, I only have so much time a day and I want to do all the best things I can. And I will say, not only from a practitioner, but from a parent, when I utilize these tools in conjunction with my families, my patients, and my own children, I definitely noticed I saw more regularity. I saw more consistency. And we all know that when we're developing new behaviors and histories, it's really important to be consistent. It's never about perfection. But the cool thing was this activation portion. Naturally, people want to chew. It feels good. This is why people clench. This is why they grind. They do that because the body is actually craving something. It's craving some type of feeling. When you put something in that you can activate the entire arch and create positive response from the neurological connection, your body naturally wants to do it. It actually releases stress and pressure in the cranial nerves and in the head, which creates the feeling of, I want to do more of this. And I don't know about you, but kids tend to do things that they like and they don't do things that don't feel good, right? So feel good, feel bad response. So in the beginning, people might say, oh, it's uncomfortable, or I don't like this, or children might say that, but that's usually just because it's foreign. Once you teach them a way to integrate, activate, naturally, they start to build a good relationship with it. As Toni Ann was saying, no tool is ever about replacing one-on-one support. And I'm an analogy queen. I don't know about you, but I own P90X, plus I have a personal trainer and I have a, and a coach, right? We all are students of life. So the more tools that you have to support your patients or your clients, whoever you're working towards, it's only giving them more options so that you can meet them where they're at. And I think that's really important for all of us, right? So a tool for supporting the 4 main goals of myofunctional therapy help us with effective, efficient, and streamlined. There's nothing wrong with these words. They're actually what we all desire and what we want. So both products are constantly positioning and setting all of us up for the 4 main goals. And that's lips closed, breathing through our nose, keeping that tongue up. And really, when you get that, you naturally tend to fall into that better swallowing pattern. And that's what we're just trying to get the body to do what it wants, right? So the cool thing about Munchee that we've been able to see, and that has been really fun over the last year or 2, is that I've been utilizing it, and we started to see that I actually could use it really as a screening and a diagnostic tool, a triage tool, a therapy tool, whatever tool you need to be in where you're at. It's really quite Switzerland of all the myofunctional, and we believe together we can show that Munchee and SpotPal really are that for all of these different programs. Nothing is ever to say one is better than that. They're just all better together depending off of your patients. So when we look at this from a diagnostic standpoint, and this slide is a little bit thing, one of the things that we notice is if a patient puts in a Munchee and they naturally gag right off the bat, this is telling you there is actually something going on with the breathing, right? Because the body doesn't normally want to gag. It shouldn't feel that awful. So it can allow you to realize, hey, maybe we have a bigger breathing issue going on here. Also, if they're heavy saliva falling out of their mouth, they can't control it, this could be a sign to tell you that we actually have a bigger swallowing issue going on here, maybe tongue control. So, gagging can tell you so much. Gagging tends to scare a lot of people, especially parents and grandparents, but actually gagging is our body's way of letting you know, hey, something's off. I need some protection, or I'm looking. And a good gag reflex means that you have proper control of the soft palate. It means that your body can handle certain things. So if they're struggling to put something in their mouth, most likely they have tactile issues, right? This is a little bit of shame, probably because a lot of this soft tissue isn't being used. It's sometimes, in a sense, lose it or use it mentality, and you have to then reintroduce it. We can go into clenching and grinding, but both of these tools can be utilized in lots of different ways. If you can get your peripheral view, you'll be really shocked to see all the different things that they can be utilized. So we wanted to kind of talk about what we used in patients and how we worked with them together. And so, the main thing that we saw was this like really amazing how they all kind of collided there, right? That proper oral function positioning, that nasal breathing, proper oral facial development. And together we really saw we could stabilize and get long-term results. So I'll let you kind of go from there a little bit, Tonia.
Sure. All right. Let's look at it. So, as Melissa said, we're going to go into some of our actual patients that we utilize both tools for, just as an example of how we put them together and how we, again, keeping in mind those same long-term goals that we just talked about, we're able to get to them more efficiently with utilizing both of these tools together. So we're going to go into Jack. Jack is or was 7 years old when we evaluated him, and he was coming to us. He was somebody that I evaluated. He was coming to us specifically for a lisp, so that tongue going too far forward on certain speech sounds, and he was having trouble with his L sound. So to some speech pathologists, this could sound like an articulation patient, but to a speech pathologist trained in myofunctional therapy, we know this isn't just about the fact that he has a lisp and the fact that he's having trouble with some L's. We know that there's probably more going on from a more orofacial myofunctional perspective. So when we look at the bite and we looked in the mouth, we knew there was a malocclusion. We saw that high narrow palate. We saw restriction in the lingual frenum. So all these big signs, once again, it's not just about those sounds that this child was struggling with. We did a myofunctional evaluation. We came up with his treatment plan. We decided that we were going to monitor his lingual frenum as he got into a myofunctional treatment plan. And then we were going to make a referral to have the palate looked at. And we wanted to first get started though with some spot pal, with some Myo Munchee, myofunctional therapy before we really got into anything. For this individual, we knew that the expansion was going to take a little bit just based on parent conversation. So we wanted to kind of jump in there and do as much as we could in hopes that we would, guide them into some earlier, well, not really, he's 7, but some growth guidance and some, rapid palatal expansion. So he was utilizing Spot Pal for 6 months. He was using his Myo Munchee at home on a daily basis. We incorporated it into treatment as we needed to, but he was pretty good with it. So we were doing that part at home. After we did those, he did go into a rapid palatal expander. During the rapid palatal expander, he continued with Myo Munchee. We did not do Spot Pal anymore because now teeth are changing. So we know that custom fit type of appliance is going to not fit for as long once that expansion starts. But they had gotten 6 months in it, which was awesome. That was great time before the expander went into place. And for this individual, he did not need to go back into a Spot Pal after the expansion. So sometimes we do have them get rescanned and get a new appliance after the teeth have changed so that we can continue with proper function for posture. But he had done so much prior and was doing so well that we really had already started to change resting posture after the expansion. So when we were working with him and we were doing Spa Pal, that was getting sent home. He was doing his exercises. We were really working on getting that suction with the structure that we had, which really is a little trickier when you have that more narrow space up there. But Spa Pal was able to help him because we were able to really stabilize that tongue tip and then work those lateral margins of his tongue and really try to get that tension and tone so that the tongue could fit as best as it could up within that palate. So he was, again, somebody that both of those tools worked so nicely for. Mom and Jack were super happy because they felt like they were doing a lot on their end at home. This was not, this was I think Jack had 2 other siblings, so they had a lot going on. And it really allowed them to be compliant with his home program and being able to incorporate those exercises that we wanted him to do so that we could really get him ready for that expansion. And then ultimately, once that expander came out, we were able to continue with a Myo program for him. But he was so used to that tongue being up there that we really felt comfortable and confident with his ability to keep that tongue up there so that he could retain that expansion that also happened through the palatal expander. Okay. We're going to go into Jessica. So Jessica was a little bit older. She was 10 years old, and she was coming to us for mouth breathing and for symptoms related to sleep disordered breathing. She was about to go into a palatal expander a week after her initial evaluation. So we recommended that she continue with her orthodontic treatment plan, but we recommended that she do begin myofunctional therapy to go in conjunction with her expansion treatment plan. And we recommended that she utilize her Myo Munchee as she was going through expansion. As well as she was going through a myofunctional program. She did wonderful with it. She, and I think Melissa will go into this a little bit more, but she really enjoyed using her Munchee specifically after she was turning the expander. So it was giving her a little bit of relief from some of the pain or tension of that expansion happening. So she really enjoyed using her Munchee. She was probably someone who used it even a little bit more than what we had said she needed to use it for, but she was really felt that it was supporting her. And then once she came out of the expanders, in fact, as she was getting ready to have the expander removed after it was in place to, the retention part, I believe for like about 6 months for her. We scanned her so that way we could get her immediately into a Spa Pal because we really knew that we now needed to work on getting that tongue up more. Now that the expander was out, she had full access to her palate and we wanted to really train that tongue to be up there. So we got this for this patient, for Jessica, we got her immediately into a Spa Pal as soon as she came out of that expander, and continued with myofunctional therapy, and continued with increasing her wear of her Spa Pal up to 2 hours a day. And then she continued with the Myo Munchee as she went through her myofunctional program. So, I mean, between the two, between Jack and between Jessica, different reasons they came to us for, but we still found value in these two tools. So one was coming really more for an articulation perspective, another one coming because of mouth breathing, because of sleep disordered breathing, and these tools were both very valuable to both of them.
So I'll talk a little bit. This is a patient for Zeke. So patients tend to come to more, dental myofunctional therapists, usually more about the dentition or definitely about frenectomy constrictions. So this was a young man that presented. He had low tongue posture, a reverse swallow. He was diagnosed and graded with a grade 2 2+ tongue tie, and he was compensating to a 2. And that is based off of the Dr. Zaghi TR-MR grading method. We created a treatment plan, myself and a dentist. I work hand in hand with dental practitioners when I'm creating treatment plans. And this was with myofunctional therapy, myobrace, Myo Munchee, spot pal, and frenectomy. And I'm going to walk you through a little bit what we saw with this young man and as we went through it. So one of the things is I'm in the dental world, so I'm always showing arch development and how it changes and how we started to get some width change. And that was actually really beneficial. We started to see the AP of the bite starting to round off a little bit, creating some more tongue space. We saw some good change into the lower arches, as well as the alignment of the anterior bite started to kind of open up, and he had spacing, but you could start to see that it was more segregated and he was having more natural rounded arches, which was allowing him, in conjunction with the myofunctional therapy, to create better function. So in our world, or especially in mine, I'm always looking at how is the structure affecting the function, and is that function creating poor behavior, or is the behavior creating poor function and then ultimately affecting the structure? Well, the younger that they are, the more moldable they are. That's what we know. I always say, think about how quickly you change clothes on children. So from those years, from 0 to 24 months, or even 0 to 5, you're handing clothes out left and right because they're growing like weeds. So the more you can catch things during growth, the more malleable they're going to be. When that growth, when they start staying in the size of clothes for longer periods of time, the growing process is just kind of slowing down slightly. Well, this just means the bones are getting a little bit more. So from a dentition standpoint, we're always trying to get in early and rectify it. So in this case, I almost want to call it, we were doing like the sealant of orthodontics. So we're being proactive, we're getting ahead of the curve and trying to rectify it before he turns into what we would call a severe class 2 Div 2 bite, which just means a division bite, meaning that the mandible is further back than the maxilla, which would then trap up that mandible, creating growth issues. And we definitely were able to achieve that in 1 year. We were seeing lots of good changes with this young man. So here's some of the initial tongue photos. And when we could see, he was quite restricted and he had unbalancing of the tongue, where one side of the tongue was a little bit stronger than the other. Now, in a lot of therapies, they would look at that at muscle tone. I look at that now over all these years, and I say, this child has an unbalanced body, equal, like one side of his cranial skull is probably more hyperextended than the other, and the bite is contributing to that process. And the tongue is literally just highlighting to me the dysfunction. So then I ask myself why, and I go, well, is it because he's mouth breathing, or is it because possibly is there that tight restriction that's creating this function? In this case, we could tell he could breathe through his nose, but we could tell pretty clearly he was raising the floor of his mouth, and then we were getting lots of neck and lower jaw engagement. And if you look right down here when he's sticking the tongue out, you can see that we don't have a lot of space. Like, you don't see the uvula, the little punching bag, very well back there, which meant that back of the tongue was raising up really high, even though he could elevate and lateralize, meaning he could stick his tongue out, he could go right or left, but you have to go deeper. So this was a case of needing him to get him engaged. So we utilize that Myo brace for stability at night, and that's very similar to a Munchee, except you don't chew on it. We use the Munchee to have him activate and stabilize, which helped all of those things you heard Dr. Mary talk about. And then myofunctional therapy to get him better tongue control. Once he was able to do that, we then did have him get sent for a tongue tie release with the doctor. And you can see now he's got better range of motion, more mobility, and he can control it up a little bit better. And what's happening is then what can happen is that he is absolutely able to control things a little bit better. So at the end of that, the best thing is what we did is we put him into the spot pal at the end to help him work on stabilization. So once you've worked with somebody who's been able to change their myofunctional habits and be able to overcome, and you've created a better growth pattern, you need to make sure that you don't just have these behaviors go away. At this age, when they're a little bit younger, you really need the consistency of the long-term kind of reminders, all those tactile cues that Toni Ann spoke about. And we found that spot pal for stability at the end, retention, if you want to call it, was the perfect tool, because what it did is it was great for our maintenance. It allowed the parents to make sure he was able to continue all of the things they spent a lot of time and a lot of money in getting him there. We needed like an insurance policy. And that was where really we started to see how beneficial and how great it was to have spot pal. Never mind, we got some retention of the arches themselves, but we were also getting retention of all the therapeutic modalities. That was one of the biggest things. And that really is what started a lot of these processes when I started to see that in the beginning cases. anytime you can give somebody a little bit of a insurance policy, there's just confidence with that, because like everything, you know, you don't want to drive around without insurance. You hope you don't ever need it, but it's always better to have it. And having some of these tools just really guarantees that. As Toni Ann was talking a little bit about palate expansion protocols, we wanted to talk a little bit about how we are utilizing these. So I'm going to talk a little bit about a case here where this was an expansion case. I'm sorry, the photos are a little blurry. But this young lady went in, we started with some myofunctional therapy, some early intervention. We used a Myo Munchee to activate, which meant to get her ready for the expander. Once they use a Munchee in the beginning, it actually decreases the sensitivity in the soft tissues, as I spoke about. But we also, as Toni was saying, we realized that the children could continue to chew on these, on the Munchee during active expansion. And that's because during active expansion, we are expanding using an inflammation process. We're creating inflammation in the roots of the teeth, which are actually create the pain. Anyone who ever had braces, when you feel like your teeth are loose or they're wiggly, that's actually because the ligament has inflammation around it, and it's creating a little bit of looseness around there, which allows the teeth to move through the bone as the bone is expanding. Now, when that happens, it can create discomfort. It can create some feeling of lack of grounding. The child can feel a little unbalanced and they can feel discomfort. And naturally, when you're uncomfortable, you might kind of like hang your tongue low, or you might kind of keep more of that like softer, like looser face. Well, when we activated it with the Munchee, all of a sudden the children kind of gained some control back. And what we realized is this was releasing that vagus nerve and decreasing some of that cranial pressure, like Dr. Mary Burke was speaking about in the earlier video. This was a really big, like a big change that we saw. So we really saw, one, the better overall compliance and overall experience for the child when we utilized this appliance during the active expansion. So you can see afterwards, she was able to really moodalize. Her teeth look really great. She's done a lot of myofunctional therapy. We've worked on some tongue things. So the question is next was, how are we going to stabilize? So there was no question in our mind what we would do. We would get her into a spot pal, and then we would utilize that for the tactile cues, which continued. We were able to get this case pretty much done in less than 8.5 months. It sped up the process in such a way. Now, the patient was very compliant, but after looking over it, what we think is we set the patient up for success. We really were able to kind of communicate and express and work with the soft tissues to build a relationship where the child trusted, and therefore they were more comfortable and open to go through the expansion, work on the therapeutic modalities, and then be very accommodating to wearing an appliance afterwards, because they got to see the results and it felt good. And that's really what all of us are looking for, right? The number one issue we hear from providers is patients aren't compliant. I'm sure you guys hear that in speech, Toni Ann, all the time, right? Compliance, compliance, compliance. So we're always trying to find ways to make it a little bit easier and make it more compliant for patients. So these two tools, after many cases, we have really seen it has helped just create a better environment for both patients overall. So I think we can talk a little bit about some of these protocols that we've kind of put together on how to use the appliances together. So Toni, and I'll let you talk a little bit about the protocol for Spot Pal.
Yeah, definitely. So pre-expansion, when it comes to expansion as a whole, Spot Pal can be used before, it could be used after, it could be used before and after. It just depends on what that family is interested in, what you feel, might be best for them. But if we are utilizing a Spot Pal before the expansion is happening, that is going to really support their, changing that resting posture of the tongue, especially before the growth starts to happen. So if we are working with the Spot Pal pre-expansion, we're thinking about their ability to identify where their tongue is supposed to be. So we're using Spot Pal so that the tongue tip knows exactly where it should go, and that the rest of the tongue can suction up with it. We are doing the tongue strengthening exercises. So As I mentioned, that Spot Pal comes with these video module types of tongue strengthening exercises. I use these even though, as you know, they're in a treatment plan with me myofunctionally or in a speech treatment plan, I still use these tongue strengthening exercises for their use at home. So they're doing that. They're, you know, thinking about where their tongue is. They're starting to get some awareness. Their tongue tip is starting to learn that spot dot, and we're trying to focus on getting the rest of that tongue suctioned up into that palate as well. And then we are using it from that passive perspective as well, of them just popping it in and going about their day. So depending on their age, if they are in that younger age range of a 2 to 4 year old, then we're encouraging that they wear it for 10-minute intervals, 2 to 3 times a day. Great to pair it with something fun, something engaging, something that they want to do. If they love to color, if they love Play-Doh, if they love, you know, maybe their bedtime story at night, we pop it in right before bed. Things like that that are going to make it motivating for them to put it in. And then if they are 5 years of age or older, that's where we are trying to get them to that 2-hour time frame a day, spread out across the day. And again, maybe it's gradual, maybe they could jump right into those 2 hours, but that is our ideal plan for them prior to them going into expansion when it comes to their Spot Pal use. And then in terms of Myo Munchee, I'll let you go there, Melissa.
Yeah, so Munchee, just as I talked about when I walked through that case, really in Munchee, it's a little bit more at their use. Ideally, if you can get them to chew on it 5 minutes twice a day, that's great. But anytime you can get them to use it if they're feeling any like extra, you know, discomfort in their cranial nerves, or they're calling it a headache, or they say, "Mommy, it just doesn't feel great," or whatever that may be, it's a great time to utilize it. When I talk about grounding, I really just mean giving that child the stability, and that's where Munchee can be really beneficial. So Munchee in expansion is a little bit more at the patient's desire. It's not as like prescripted. So they have a little bit more flexibility. The goal is just, again, to be consistent with it. And then, oh, sorry, we'll go. And then it's same thing during expansion, same thing, be consistent, just work through it. So sorry, for pre-op, the main objective is trying to desensitize those soft tissues in their gums. And then during expansion, you're utilizing it graze. But the same thing with Munchee, you have a little bit more flexibility because you need to just activate and swallow and be part of it. So you can utilize it as much. We just don't recommend more than usually 10 minutes a day, especially for kids under 10. And that's because if you are chewing something, the truth of the matter is that you're probably trying to compensate for something else, meaning that there probably is maybe some clenching going on, sucking on the appliance. And then what you kind of end up in a situation where you could create more, like another poor dysfunction. So really that word of like moderation is key. Anything to an extreme, one or the other, could be a sign of something else going on that you might be missing. Again, that's where Munchee can be a really good diagnostic tool. So just different ways to kind of keep an eye and look at it. And then post.
Yeah, so post-expansion, the expansion has happened, the expander is coming out or is out. If they were utilizing a Spot Pal already prior, then they are going to get an updated Spot Pal, a new scan, because we're hoping that that growth has been fabulous and now their original Spot Pal doesn't fit anymore. So they're going to get a new scan and a new appliance. They are going to continue with their tongue strengthening exercise program or their myofunctional therapy or their speech therapy, and they're going to continue with wearing that Spot Pal. So many times, you know, after that expansion happens, if that tongue does not get up there and hold that expansion, we see it unfortunately more than we would like to, that, you know, there's a relapse in that expansion. They were wider than they were. So we really, really want to get that tongue up there. We want to get that tongue up, suction to the roof of the mouth. If they're wearing their Spot Pal up to 2 hours a day, then we know that they're working on that tongue posture during those 2 hours, but also outside of those 2 hours, because of how much that sensation, that tactile support is going to continue even once that Spot Pal is removed from their mouth. And then continuing with the Myo Munchee, 5 minutes, twice a day.
Yep. Exactly. Post-expansion, same concept.
All right. Okay, so I know we are 2 minutes till what we plan to do, but I think it's worth it. Even if we go a minute or two over, we can get through this tongue-tie protocol pretty quickly. But that is another area we both, Melissa and I, have realized we are really utilizing both these tools, not just for those patients that are going through expansion, but the patients that are going through tongue-tie releases. So when we are looking at a patient who is pre-release, you're going to see in these videos that are playing that the patient is pre-release, so she's pretty tied in these videos, pretty restricted. But what are we working on? She's putting that spot pal in. She's learning where that tongue tip is supposed to be able to go, where it's supposed to feel comfortable being. She is all about awareness here, teaching her, you know, that first time we tell her that's where your tongue tip should be at rest. It's like, you have to be kidding me. How could that be? So trying to increase her awareness, getting her to wear the appliance throughout the day from that more passive perspective so that she can start to learn for those muscles to know where that tongue should be. Doing the exercises the best she can. This is pre-release, so we're probably going to have jaw involvement. We're probably going to have dissociation difficulties, but we're just, you know, starting to kind of plant those seeds for her and getting her ready for the tongue-tie release. Like I said, increasing her awareness, teaching her that tongue tip placement to her spot dot, and establishing that tongue pull or that suction as best as she could prior to the release. And then Myo Munchee.
Yeah, Myo Munchee, the same concept. You're just kind of maybe still using it, like putting it in and trying to work on lip seal, trying to create and promote strength. It's very good for the oral bicularus, which actually supports pre-op for a tongue-tie protocol. Desensitizing the tissues helps a lot, and releasing cranial nerves and compression is actually really beneficial for optimal release. So we're always trying to set the tissues up. As you heard Dr. Mary Burke say, is that restrictive tissue can really, if it's really tight and it isn't like really moldable or flexible, it can make the release itself a little bit trickier. So the more they're chewing and the more you're breathing, the more oxygenation is getting to the tissues, better off for the actual outcome.
Oops.
Oh, so
And then post-release. So again, same patient, you're going to see her put her spot pals in. And then post-release. So now we see that nice range of motion underneath that tongue, that real suction. She is using her spot pal to know where her tongue tip should be so that the rest of the tongue can suction and fit within the confines of her palate. She is wearing her spot pal, recommended amount of time, 2 hours a day. She's obviously that 5 years and older age range. So she is going into her spot pal at rest passively throughout the day, but then doing all those super important myofunctional exercises so that we can support the healing process, support the neuromuscular re-education, and, you know, continue her along this journey now that she has this amazing range of motion of her tongue. And then she did continue with Myo Munchee, and I'll let Melissa say that.
And Myo Munchee for tongue-tie protocol, you know, there is some different ways. I know different providers that do it in different ways. The main thing is that you can chew on it and it can give you that relief, especially if you're really sore under there. But at the same time, because it produces more saliva, that will help support the healing as well. Sometimes in the beginning, in the initial thing, they do want to wait about a week before they actually put it in. It can be a little discomforting. You kind of want to feel the patient out. That's a little bit more kind of based off of how you're feeling, how the patient's feeling, and what you think is best for them. But the more you can support proper swallowing, you're going to get better elevation. So one of the things we talk a lot about when it comes to tongue-tie protocols and post-op support is we want them to be able to use the tongue and speak as much as possible. So speaking and drinking and swallowing are all these great natural ways to support post-op release. And sometimes chewing on it is just feels more comfortable. It releases those tissues and promotes more swallow, which can optimize the whole experience overall. Saliva has lots of good qualities that can even release the discomfort sometimes as well. So lots of fun ways that you can utilize both of these products. I definitely think you get to see how they support any traditional plan, as well as support the concept of just creating this experience for all of our patients, that we wanted to give them more options so that they could get the most out of their experience. And that to me is what is most exciting. And I think the evolution and the growth of this whole industry is the beauty of people thinking outside the box and creating these different products.
Absolutely. I couldn't agree more. I think it really just empowers the patient, you know, to feel like they have some control, they know what they're doing, and allow them to be successful, especially when they're not with us and not in our treatment rooms.
Absolutely.
Is obviously Melissa and I's contact information. So please feel free at any point to reach out to us if you have a patient in mind and you think they would be good candidates for a SpaPal, Myo Munchee type of protocol. We would absolutely love to set up a time to, you know, help you through that process a little bit.
Well, this was absolutely so fun. And I think really, you know, educational. This was definitely the first time we've been able to put together a proper presentation, you know, to really walk our patients through. So we're super excited to get some feedback and some, you know, questions if you guys want to send them to us via email. Or I think what you had said, Toni, and this we'll be able to send the link for people to watch the recording. So if you know anyone that's missed it or has more interest, we'd love to talk to them more about it, because ultimately you can get a lot out of using both these products.
Yes. Wonderful. Thank you all so much for joining us. And yeah, I guess that's it.
Well, Toni, and I hope you have a wonderful evening. And thank you everybody for spending time with us this evening. And we definitely look forward to you. I think this will definitely be the first of more of these types of informational webinars. And let us know if there's anything else that you need. I hope everybody has a great evening.
Have a good night.
Bye, guys. Thanks.
Bye.